Today, we're discussing Botox. What's it for? Hello TLCers. So today we're going to be talking about Botox, which is my second favourite thing. As we all know, my first favourite thing is dermal fillers, but more about those another time. I always get asked exactly what can you use Botox for in aesthetic medicine? What does it do? What am I going to get from it? What's the big deal with Botox? So we're going to be discussing that today, and then at the end of the video there's going to be another before and after for you to check out, have a look at, cast your eye over, tell me what you think I did in the before and after, and then we're going to have the big reveal next week where I tell all. Before I go any further, I just want to highlight to you that Botox or botulinum toxin or whatever you want to call it is a prescription only medicine. So you can't just, have it done because you fancy it. You need to have a consultation with a prescriber before you're able to do that. And they'll be able to guide you as to whether or not it's something that's right for you, because it's not right for everyone. Let me tell you what Botox is. Botox and botulinum toxin can be sometimes used interchangeably in the press, and often the shortened term Botox is used to mean a whole host of different things. So sometimes people actually refer to dermal fillers as Botox, and they're totally different to each other. There are many different types of botulinum toxin, but Botox is kind of used as a bit of a shorthand because let's face it, it's a bit of a mouthful saying botulinum toxin every time, but Botox is actually a brand name. So it's like saying Hoover or Dyson or Vax if you're really into your vacuum cleaners. There are other brands available out there, and whoever is administering your Botox or your prescriber will be able to tell you why they will choose one brand over the other, because they do have all very slight different characteristics. One might spread a little bit more, another one you can keep out the fridge for a little bit longer. So there's all these things that go into them deciding which one would be right for you. How does Botox work exactly? Well, between the nerve ending and the muscle, you've got like a little junction there, and Botox works by blocking the chemicals from going across that junction. So your body can't tell that muscle to, hey, you've got to move now. So that whole transmission is just stopped. How does that translate to a good result in your face or aesthetically? Well, it's because as you get older, you have more tension in the muscles and they tend to pull a little bit more, which is why you end up with lines and wrinkles, say in the forehead or around the crow's feet. So if you are telling that muscle to stop being so tense, it will relax, and quite often the muscle will relax as well. When you're having your injections done, you're not going to see anything happening for a good 5 days. So when you leave the clinic, you have like these little bumps on your skin, which is just where the injection's been done. And then those bumps are gone after about 20 minutes. You'll see nothing for about 5 days. And then slowly you'll notice that it depends on the area that you've had injected, obviously, but you might notice that you can't frown quite as much as you used to be able to, or maybe when you're smiling, you're not getting as many crinkles around the eyes, for example. And then it probably takes about 2 to 3 weeks for you to get the maximum benefit from having those injections. And the question that I'm asked an awful lot is, how long is it going to last? Now that's actually a really super difficult question to answer, because Botox, it lasts until you regrow the nerve endings there. So there are many factors that can influence how long your Botox is lasting for, but the speed of regrowth is one of the big factors. There can be other things as well, like how dilute the product was when you had it injected, how many units they used for you, how long that particular vial of toxin had been open for as well, your metabolism, so how quickly you're going to regrow those nerve fibers is actually really super important as well. So as I said to you before, Botox is a brand, and there are different ones available in the UK, because I'm filming here from the UK. There are different ones in different countries. So what we have over here is Botox, which is made by a company called Allergan. Confusingly, it's also called Vistabel, and the difference is just in the size of the vial. So Vistabel is a little vial and Botox would be a bigger vial, but it's the same thing. They also make Juvederm, by the way, which is a dermal filler, and many different types of breast implants too. We have another one, which is called Azzalure. That's a whole different company who make that. It's also called Dysport as well. So the difference between the two, again, is just the size of the vial. So the Azzalure is a small vial, the Dysport is a larger vial, but they're the same. And then we have a third company who make Botox and Xeomin, which are again the same as each other. So the Botox is the small version of a larger Xeomin. Now, they're all made by different manufacturers, so they've all got very slightly different properties about them. And the one that your prescriber decides to use, they will have a reason why they've chosen that one over a different one. Myself, I do use all three, depends on the person and the problem that I'm trying to treat at that time. And there's not any reason to say, oh, one of them is better than the other. They're just all very, very different. In clinics, the thing that people tend to do quite commonly would be things like the frown line and the forehead lines and the crow's feet. That's where that term 3 areas of Botox comes from, because, well, actually I don't know why, because I tend to use it quite a lot in the lower face as well and not do so much in the upper face, but that tends to be what patients have mainly heard of when they come in. Let me show you some of the places where we can inject then. So you might be looking in the mirror thinking, oh my gosh, I really, really hate those lines in between my eyebrows. Ooh, because you're squinting a lot. Maybe you're out in the sun quite a bit. You haven't got any sunglasses. You're squinting. You get these lines here. I don't have them because I've been treated, but some people do have them. So you've got 3 muscles here, which all kind of contract together, and that's what forces your brows together to give you these little 11 lines. And let me just show you on the head that I have right here, exactly where they are. So you've got one big one right there, and then 2 smaller ones on either side there. And what they do is they pull your brow downwards and inwards on itself to give you that concertina ring. So when we use toxin there, it stops that movement and it allows the brow to come upwards, and it can make you look a little bit more rested as well, which is quite cool. Another area which is commonly injected is the forehead. So you have these 2 big flat muscles here on either side, and they're responsible for you raising up your eyebrows like this, up and down. So these 2 pairs of muscles are in opposition to each other. So you've got these big forehead muscles which raise up your eyebrows, and then these 3 depressors that we just spoke about, which depress your eyebrows down. And this leads to quite an interesting thing, because if you're going to inject the upper part of the face, so the forehead, you really have to do this area as well, because if you don't, then they're going to be unopposed. The depressors will be unopposed, and then they will pull the brows down too much, because you won't have these elevating muscles pulling up the eyebrows, and you can look really weird, like a monkey sort of weird. Not a good look. Another area which is quite commonly injected is the smile lines, or the crow's feet, which are the lines just next to the eye here. And a really interesting way that you can see which lines would be reduced if you had toxin put in would be not to smile, because when you smile like that, actually the skin gets bunched up here and it concertinas next to the eye right there. But if you purse your lips and squint at the same time, you'll then isolate the muscle which is responsible for causing some of those lines around the eye. So you go like this. And then you can see exactly which lines there can be reduced by having toxin put in there. And that's this big muscle here, which is this, you see that big round one that goes all the way around the eye there? You just do the injections right here. You can't inject the rest because, well, you just can't, it will look really strange. Interestingly enough, that muscle is also responsible partly for the shape of the eyebrow. You might have heard some providers talking about their ability to change the shape of the eyebrow using toxin. It's totally true, you can, if you know the anatomy well. So one of the things that we look at when deciding where to place it is the symmetry of the brow. So if you're looking at yourself from the front and you can see that maybe one eyebrow is slightly higher than the other, so like on me, this eyebrow is a little bit lower than on this side, and that's because I have a little bit of tethering of this ring of muscle around the eye. So it's this part right here that I need to inject, and that will allow the middle part of my eyebrow to come up. So you can do all kinds of fancy things like that to kind of give a bit more symmetry back to the face. Another really interesting use of toxin is around the eye, but the inner part of the eye. So as we get older, if you look at pictures of yourself when you're maybe in your 20s and smiling really broadly, and then you look, if you're a little bit older, say you're 40 or 50, see your smile now, you'll see that the actual aperture of the eye, so this distance here, is a lot smaller as you get older. So you will have these really wide looking, you know, big eyes like this even when smiling in youth, but as we get older, because the ring of muscle contracts and gets very, very tight, it gets smaller and you kind of look a little bit squinty. So you can use toxin there as well to help to open up the eye, to give you a much more smoother and more wide awake look when you're giving a big grin. Moving on down, we're going to talk about the bunny lines now. So this doesn't happen on everybody, but sometimes as we get a bit older, the muscles right here, which are those muscles there, they start to contract a little bit more, and we get these kind of lines on each side of the nose, also colloquially called the bunny lines. Again, you can use the toxin there to reduce the appearance of those lines, and that's something that I think I do quite a bit of in combination with the frown line treatments, because I don't know if you've noticed this, but sometimes when the frown lines are treated, if these aren't treated, sometimes people can develop a line right across here which can look a little bit unpleasant, you know. If you're a wind instrument player, you're probably not going to want to try this, but you can also put Botox around the mouth. So for people who have got very small vertical lip lines in the upper lip, and actually the lower lip as well, you know, where it just gets a little bit creased, a little bit crepey, you can also add a bit of toxin in there, which helps this muscle, this one that goes all the way around the mouth in that big ring, helps to stop that contracting. Now, the problem with doing that is if you're a wind player, you know, giving a bit of a on the flute or whatever, you're not going to be able to do that quite as efficiently as you could before you had the toxin put in. So just bear that in mind. Some people also do it there to flip the lip up a little bit too. So it kind of goes like a little bit like that, very slightly afterwards when you've put toxin in there, which can look quite nice on some people. The nose is an area actually that you can do a few different toxin injections on. So in some people, when they're smiling, the tip of the nose goes downwards. It kind of goes like this. Mine doesn't do that. I had a rhinoplasty, so it's kind of stiff. But on some people, when they're giving a big grin, the tip of the nose goes down like this. And so you can use toxin just there, which helps to elevate the tip of the nose slightly, and it can look quite attractive. Something else that you can do with toxin would be for the nostril as well. So if somebody's got an awful lot of nostril flare, you know, where you can really see that it's just curving quite far up like this, you can also just add a little bit of toxin there, and it will help to reduce that flare, which can look quite nice. The chin is also a really common area that I personally inject, and that's because as we get older, this chin muscle right here, it becomes super strong and it pushes your chin upwards and rotates it like this in that direction. So you end up with a line across here. Also, you can see with age, there's a bit of dimpling and some like undulation in the skin, which most patients don't realize that they have, because when you look in the mirror, you're not talking to yourself in the mirror. or at least most people aren't talking to themselves in the mirror, so they don't know that they've got this issue. But it is somewhere that I inject quite a lot on people because really smoothing that area off can look really, really lovely. Lower part of the face again, we've got these muscles right here which pull down the corner of the lip. So like this. I need to get mine done again because I have really, really strong muscles there. You see that? Oh, no. So if you inject this muscle right here, this big triangular muscle there, it will stop the pull down of the corner of the lip occurring quite as much, and it gives you sort of this like happier and more rested look. Now I'm going to talk about people who clench and grind their teeth. So clenches and grinders are a little bit different to each other. As somebody who clenches their jaw, you know, they'll have a lot of tension in the jaw like this, and you can see that up here in the temporalis muscle, which is on this side here. Yeah, you see this big fan-shaped muscle right there? It's that there, and you can see it almost popping out sometimes on some people. Also, they will have sometimes a large masseter as well, which is, where are we? Yeah, there we are. It's on the opposite side. That's kind of annoying, sorry. This long muscle right here going from the cheekbone to the bottom side of the jaw there. So there's two muscles involved in people who clench. Grinders, slightly different, so it's often just the masseter for them. People who clench and grind their teeth actually might not know that they're doing this. So you might wake up and maybe your partner says to you, hey, you were really making some noise last night because your teeth were just like rubbing against each other so much. Or it might be something that you know because, you know, when you're getting in a slightly stressful situation or you're feeling slightly tense, you know, you've just got this like tension in the face that maybe you notice, maybe it's something that other people are going to notice, but Botox can definitely help reduce that stress, that tension there for you. You can also use Botox to slim down the jawline a little bit. So in people whose masseters are enlarged, it doesn't necessarily mean that they're clenching or grinding their teeth. They might just have quite a big masseter muscle, and actually there's not really much correlation often between the size of the muscle and how much irregularity of function that person will have. So we can again inject the masseter using Botox just to slim the face and give a bit more of a V-line shape to the face. Obviously it's not suitable for everybody because not everybody's got big masseters, but if you do, it can look really, really nice. Moving down the face then into the neck. So some people as they get older, this big muscle band which is between the lower part of the jawline and the clavicle, it's called the platysma, it gets tense and it starts to stick away from the neck tissue a little bit, and it causes these bands, you know, those vertical bands that sometimes slimmer people get. They're just the platysmal muscle just being really tight there and pulling away from the underlying tissue. So if you just use a bit of toxin in there, it can help the skin just sort of fall back against the neck. You might have heard of the Nefertiti lift. So that's where you do that particular technique all the way along the jawline on both sides in the hope that the skin will drape a little bit nicer. It doesn't work for everybody. I would say maybe around 10 to 20% of people could have that done. Are you kind of sweaty? Because if you're kind of sweaty, then you can also use Botox for that too. So one of the really common areas to inject is the armpit, especially in summer. So in people who have got maybe overactive sweat glands in the armpit or in the palm of the hand or in the feet, you can use toxin in there to reduce the sweating. You can also use it in the face as well. So, you know, some people get quite sweaty in the forehead or in the hairline, you can use it there as well. And that will diminish the amount that you're sweating, which is kind of cool. Just in the same way that you can use the Botox to reduce sweating, you can also use it for people who have got maybe open pores or who have got a little bit too much sebum production on the face. The way that we do this is by really super diluting the product down and maybe mixing it with either some PRP or a little bit of a mesotherapy treatment and using it all over the face in really tiny little doses. And what that does is it actually shuts down the amount of sebum production that you will have in that area, shrinking the pores down, which again is kind of cool. Something you might have seen in the press is Scrotox. Now, this isn't something that I've ever been asked to do. I can't imagine it being hugely popular, but some people are using Botox in the scrotum to reduce the wrinkling there. I don't know, I guess it would work. Calves, not baby cows, but part of your leg. So if your calf muscles are a little bit too big for you to fit into those knee-high boots that you bought for winter, you can use Botox in there to help shrink that muscle down, just in the same way that you would use it in the face. This is actually a really popular treatment in the Far East. We can also use Botox for migraine. If you're somebody who's tensing a lot and you carry all that stress and tension in the muscle, you can use Botox in this part of the head to help reduce that stress and tension, which for some people gets rid of their migraines. Interestingly, a lot of people, when they have their forehead and frown lines done, they comment that the first time they have it injected, they develop a headache, which then goes away. And I find that the vice versa is true in people who have been having injections done in the forehead for a long time. So when it starts to wear off, they say they're getting a headache. Let's talk about the medical uses of Botox now, because it's not just for cosmetic purposes or for getting rid of sweating or clenching your teeth or migraines, things like that. People also use it for in the bladder, for example. It can be used in the neck as well when people have got a neck spasm. In fact, the way that it was kind of discovered, if you like, was actually because of the medical uses. So there were a couple of doctors over in the States who were using it for people who had a spasm of the eyelid here, and they were injecting this area right here for the patients to try and get rid of that eyelid spasm. And what they noticed was that their patients just keep coming back again and again and again, even when their spasm had gone. And eventually they got a bit wise to it and they were like, "Why are you coming back? Your problem's gone." And the patient said to them, "Oh, it's because I like the way it looks. It's got rid of the lines in between my eyebrows." And then boom, the whole industry was just born from there. All right, guys, that's it for this week. Hope you enjoyed seeing a bit more about what we can use Botox for. Don't forget to watch to the end of the video, because there's going to be another Guess What We Did with a before and after from a patient. Please indicate below in the comments what you think we did for that particular person, and then I will do the big old reveal next week where you can find out if you were right. Don't forget to like, comment and subscribe, and I will see you next week.